Grievance log, I believe thank you so much to whoever hit record, appreciate it. We were talking a little bit about the grievance log, and there was some conversation around some of the kind of the new additions here. And I believe we wrapped that up, but I want to maybe see if there were any further reflections from yesterday, from that grievance log and discussion. No, okay, I'm not seeing anything.
Christina Hartman has her hand up.
Oh, thank you so much. I'm not, for some reason, I'm not, oh, I guess it's because I was sharing my screen. I wasn't seeing hands, but feel free to chime in. And no need to wait to be picked on. But Nancy, thank you so much for helping me realize that. Christina, do you want to go ahead?
Yes. Are we still waiting on a follow-up on how to fill out the log when we are delegating the grievances? That was the last question that was asked before the meeting ended yesterday.
Yeah, so I think that will be something that we will incorporate into the reporting instructions. And can I maybe, Christina, if I can maybe ask you for a bit more, maybe if you can dive a little deeper into that, that might help me understand where we need to focus for the clarification. And I'm thinking that it goes into reporting instructions, but it's possible there may be more beyond that. But if you can dive in a little deeper to help us, help me clarify that in my brain, that would be helpful.
Sure. So for the specific instance, we have Advantage Dental. So any complaints that come in through EOCCO that are Advantage Dental, we would send it to them within 1 business day, and then Advantage Dental would complete the grievance and including the resolution letter and mail it out. And then they send us, EOCCO, the completed case file so we can input it and hold it into our system for reporting. So when it comes to figuring out as EOCCOs receiving it, but we're not handling it, there it's being delegated, exactly how we should fill those out for the log.
And are we only talking about the new fields, or like, or does that include fields? Okay. So just the new fields. Okay. Got it. All right, that sounds good. So I do think that that's probably something that we could further clarify in the reporting instructions, and knowing that, that's a place where you need some additional clarity. We can focus on doing that there. And the reporting instructions will be released in tandem with the revisions to the reporting templates. And so yeah, go ahead.
Just to piggyback off of that. So we also delegate dental, which would be identified from the service type in column I. So it seems like instead of adding new fields, to identify which ones could be delegated, could we just I don't know, have somewhere that would indicate if it's been, if that service type is delegated, yes or no, and then by whom, instead of, you know what I mean? Instead of having to record if we got it, like in column Q, how I understand it is the CCO gets it, but we delegate it to Advantage Dental, which is in column O. We have to put that down, but yet they're fully doing the process and we just have oversight over it, right? But all of that is driven from the service type. which could be identified without having to include new columns. Does that make sense?
Yeah. That makes sense. We'll take that back and think through it, and see if there is a need for columns Q, what is this, Q and
Oh,
R, so yeah, QR, well, O, QR. And then maybe, I think there's probably a need for O, maybe Q and R either can be revised and or we can determine if they need to stay. But I think that's a really good point, because we're only going to be, and we already know, who you delegate, some of these functions to. So we should be able to kind of determine who, we would expect to see here. But okay, I think that's a really helpful.
I think years ago we had a tab, like a summary tab, if I remember right, where we included what our enrollment were and totals. So maybe even having just a summary tab that said, for certain service types, is there delegation, or something mapping that to where we don't have to do it for every tab, but it is clarifying when things are delegated or not and by whom.
Mm-hmm. And I think we'll go back maybe to our intent as well. I think from our perspective, what we have seen, there have been, and Carrie, feel free to chime in here since you have some historical experience here. What we've seen is that there are some gaps in terms of that oversight and monitoring of those delegates that are performing some of these functions for you, right? So that's where we're kind of trying to get a better sense and really, try to kind of ramp up our monitoring of your, what level of oversight exists for these subcontractors that have been delegated some of these appeal and grievance system functions.
Would that better serve in the narrative template instead of by recording rows to identify whether what that delegate is reporting to us instead of what is our oversight? Because how do you capture oversight by including the data within the rows if that's the intent?
So I think there's one thing we wanted to do here was to start to look at trends across subcontractors. And that's why we were thinking we need that data here. And yes, you're right that additional piece we are getting in a few different places. CMR is one of those, right? We're also getting that from our NOABD sample reviews, right? Some insight into some of that subcontractor oversight. And you're right, if there's a need for anything in addition to that, in addition to those places where we're already seeing and getting information, a narrative could be something that we consider. But I will say just kind of now that we are actually proposing to get rid of most of that grievance system report. Yeah, and so that's why we want it here. And I don't know if there's anything you want to add there, Carrie.
I think also just with the reporting template itself, having that information around timeliness of processing, those types of things to, in alignment with what Veronica was just saying about identifying trends, having the numerical quantitative data that this level of reporting would provide would kind of help us more on that path than perhaps a narrative approach would.
Yeah. So that's a little bit about just kind of where, our intent with gathering this information and where we are headed. And I just saw a hand go up. I don't know if there's another one before that. So if there's anyone else before Melody, please feel free to chime in. If not, Melody, please feel free to go ahead.
Yeah, kind of on a different topic, just pivoting a little bit. So if there's any other discussion we need to finish up about this particular topic, I'm happy to pause to give others an opportunity.
Thank you, Melody. Any other discussion on this particular piece? Okay, I'm not hearing anything else, so Melody, and can you check the chat to see if there's anything there? Okay. I don't think there's anything in the chat, so why don't we just, Melody, if you want to chime in, and then we can.
Yeah, absolutely. Thank you so much. My question was about grievance categorization, and it's not really anything that we've changed, but I did notice on like the system code tables that we're going to be updating to add some more categories with a little bit more specificity in those categories and things like that. One question that I had is at times when we're filling this out, there are certain complaints that are directly attributed to the plan, some that are attributed to provider, and then there are other categories that do not specify whether it would be a plan or a provider complaint, which sometimes creates some confusion about when the appropriate usage of those categories is. And so I was just wondering if slated in any of the updates that you all are making with some of those additional expansions on the notes for grievance categorization, if there's going to be any direction about what the expected use would be of some of those categories when it does not specify plan or provider.
Great point. I don't think that that's something that we have planned and or thought about. Carrie, is there something I'm missing that you're remembering?
No, not that I'm recalling in this moment. So
are there specific categories that maybe are, kind of consistently coming up?
Yeah, I would have to look to see exactly which ones there are, but one that comes to mind would be like unable to schedule an appointment in a timely manner. It doesn't specify plan or provider, but if a member, say, made an appointment to come in and speak to us at Pacific Source, but they felt that they weren't able to come in fast enough, it would maybe get categorized under that. Whereas likewise, if they weren't able to get into their provider fast enough because of something that was happening with the provider, it could also fall under that category as well. That's the one that kind of pops to my mind first, but
Okay.
without looking at the system code tables, I can't pull it up out of my brain.
Yeah, no problem. I would say that if you can submit some of that information, that might be really helpful so that we can go back and take a look to see where there might need to be some further refinement to clarify, plan versus provider.
Okay, wonderful. That would be fantastic. And then also just a follow-up question to that, with the addition of the grievance identification or ID field that we're going to be having, and the ability to use that to track multiple categories of concerns from members. If say a member had access complaint that fell under two different grievance types. So like, let's say there were two different types of access that the member was having challenges with. I just want to confirm that we would expect to see two different lines for that complaint with both of those categories listed. Is that correct?
So I don't know, Shivani, if there are any immediate thoughts you have about that in terms of what you've discussed for our data analytics purposes.
So Veronica, we are still deciding on that, but for now we can have two different lines.
Okay.
So Melody, TBD. We are still kind of working through some of these things as we're having these conversations, and as I said, our next step after this is to turn to the reporting instructions to update that, and that's really where we will define all of this. But I think helpful to know that that's something that you want to understand.
Wonderful. Thank you so much. I really appreciate it.
Okay. Anything else? Let me check the chat. And I see Christina Hartman. You dropped a note there. Thank you. Okay. And I don't see any other hands. So if there aren't any other hands for the grievance log, and again, we can come back. So, feel free to chime in after if anything kind of pops up for you. Okay, I'm gonna move us over then to the appeals log. And there's not a whole lot to talk about here. I think maybe so we haven't proposed any changes to the appeal log. At this point in time, we feel like it kind of comprehensively captures what we need right now. That might change as we start to kind of build out our ability to develop dashboards and track trends over time. But for this specific iteration of these changes, we are not proposing any changes to the appeal log. But I wanted to maybe just open it up to see if there is anything from the CCO perspective that we may want to think about in terms of modifications to this tab.
I do have
Melody,
just
go ahead.
Thank you. I do have just a couple questions on these. One of the challenges that we've run into as we made this switch to this format last year was that when we submit, it seems like OHA, when we're reviewing that documentation, we only do a look back to NOABD IDs that happened in the quarter previous or the current quarter. But there are times where it is appropriate to waive timely filing if the member had good cause for that. And so we find that it's not fully capturing all of the appeals that we may be processing in the quarters, because the direction has been to remove those then because it was outside the look back period. So I just wanted to first find out, is that something that we're planning on continuing to only have that one quarter look back?
Yeah, that's a really good point. And I don't know, Carrie, if you and or Shivani have any immediate thoughts on that. I don't think that's something that we've discussed, but maybe obviously, we want to make sure that we're getting the most complete data, and we're obviously missing some data there. So that definitely might be something we want to circle back around to.
Okay.
Clarify that in the instructions document, how to handle those.
Okay.
Wonderful. That would be fantastic. And then the one other question I had was with the addition of the appeals pending section, if we could get a definition of what the expected pending would be. Would it be pending a decision, pending a letter? Just a little bit of expansion on what the expectation would be in that section.
All right, great. Thank you so much. Anyone else have any thoughts about changes to, and I see Lindsay, you dropped something in the chat. Can you add to the instructions to clarify the date should be in the date of NOAR if the member withdrew the appeal?
Yeah, I think in previous work groups we've discussed, so like a withdraw is really like a cancel. So we don't send the NOAR, and that kind of aligns with like the letters as well, right? Like you don't send an NOAR if they withdrew, you send a withdrawal letter. So it's not really a resolution. So then do you report it in the date of NOAR because you're already reporting that date in column N of the date they withdrew, or are those meant to be two different things?
Okay.
So I know in previous discussions we've talked about it, but I didn't see it notated in the instructions.
Okay, that is helpful. I think we will have to maybe circle back to that and talk more about it.
Yeah, I agree with Anna as well, same with dismissed untimely filing, whether we include an NOAR date.
So we include date of NAR only when the appeal outcome is either upheld, overturned, or pending.
That's the only time you should have a date in that field.
Yes. Yes.
Yeah, that's what I thought, but it's a little unclear in the instructions. So if we could just have that clarified, that would be really helpful. As
Yeah, we
we
have already
train
added that
future.
in the revised
Okay,
version. Thank you.
excellent. Thank you.
Okay, thank you for raising that. Any other things like that where, because hearing from you where there's maybe confusion, or maybe the instructions could be further updated, that's really helpful feedback. So if anyone else has anything to offer, not just on the appeal log, but for any of the other tabs, feel free to weigh in. Okay. I see a hand up. I can't see who it is, but feel free to chime in.
This is Anna from Advanced Health. One thing we run into on the appeals log and in the error checks that OHA does is there are some fields where it's like a yes or no answer, essentially. But some of the fields, you only put yes, and if it's no, you leave it blank. And some of them, if it's no, you have to put a no. And if it's yes, you put a yes. And so there are no blanks allowed. And those are ones that trip up our staff when they're reviewing these because it's not consistent in all of the fields.
So Anna, we are working on that and we are making it consistent now. So there would be only yes or no and no blanks from now onwards.
Okay, thank you. Because it is helpful to have them all filled in so that they know
Right.
they've answered it one way or the other. Okay,
Yeah.
thank you.
Thank you for raising that, and appreciate that that call out. Let's see if there's anybody else that I'm missing here. Don't see anything else. Any other comments beyond what you just beyond what you raised, Anna? Anything else on either the appeal log and or reporting instruction clarification? Okay. I'm not hearing anything and I'm not seeing anything in the chat. Oh, thank you from Rihanna. Okay, so we will move on then to the appeals pending piece. This is a new one. So as I mentioned, we'll go to this here shortly, but we have, and actually I think we just need Q4. So we are proposing to get rid of the grievance system report, and this information here is information that we do need for our annual reporting to CMS. It's a new managed care report that's being required of all states, and so this is information that we're not currently collecting that we do need to start to collect. And as you can see, I just made a modification to note that this is only applicable to Q4. And so the whole, what they're seeking, as you can see, is anything that's kind of pending and open, or still being worked, right? An appeal that's still being worked at the end of that Q4, that might remain open into the next year, depending on the timing and when it's received and all of that. So that is information that we do need to track. And so that is why we are proposing to add a new tab here to request that information only for Q4. And we can figure out if we can integrate it into the appeal log, but for right now, for our kind of demonstration and conversation purposes, we just kind of added it as a new tab here. Any comments and or questions about this? Can that information be pulled from the log?
So the
Technically,
appeal,
yeah, I
the
mean,
appeal log has the NOAR date. So if that
resolution.
date is in January, you would know it was pending, right? At the end of December.
So it would be, we would need it, potentially, maybe we'll go back and we'll explore if we can pull this ourselves. I think one of the issues that we've had, and Shivani, maybe if there's anything you want to add here, feel free to chime in. But one of the issues that we've seen that I saw in this most recent report that went to CMS, which we just completed 2-3 weeks ago, is the quality of the data. There were quite a few issues. So with the, I think we could get to this if we have some, good quality data, and specifically able to look at those appeal resolution dates that are in that appeal log file. So if they are, and I think there's also a place where you're indicating whether it's pending and open, we could pull it, but that there is definitely, there might be some back and forth that we need to do, depending on kind of the quality of the reporting. And that's an area, just for everybody's kind of awareness, that this is something that will be highly focused on in this, after we make these updates, we'll really be focused on improving the quality of the data. So we'll have kind of more interface with you all, more technical assistance, offering kind of more information to help improve the quality of that data and reporting. Shivani, is there anything you want to add there quickly?
I think mostly it's about the quality of the data only, Veronica. Like, we did not have data of anywhere at many places where it was supposed to be. Somewhere it was not added as pending, but there was a data of anywhere. So we are not 100% sure if it was pending or not. So there were issues like that. And sometimes the date itself is wrong. So we don't know if exactly it was pending from the last quarter or not. So those kind of issues came up a lot when we were doing the CMS reporting. This is why we were thinking like if there could be other way around to find out all the pending ones at the end of the quarter 4.
Mm-hmm. So it's possible, for sure. It's going to be dependent on, how much improvement we see in the quality of the data. And, we won't have to submit this report again until it's an annual report, as I mentioned. It won't need to be submitted until June of 2025. But obviously we want to start to improve the quality of the data now. Okay. That covers the changes to the grievance and appeal log. I'm going to pause there and see if any of my colleagues want to add anything before we move along. No. Anna, anything from your end?
I think you're talking to me, Veronica. Nothing from our end.
Okay.
But can I ask one question about the code group table?
Yes, we're going to go there next, but yeah, go ahead.
Oh, okay. Okay. I can wait. I guess my question was around where you have a CCO category, but then you have case management that is also a CCO. So it, just trying to understand why case management in particular needed to be broken out. But
yeah, let's go there next. And then I will, let me just bring that up here. Just 1 second.
There was one last comment in the chat also.
Oh, thank you, Nancy. Just 1 second. Okay, let me make this bigger so everyone can see. And I think you're talking about service types. Probably.
Yes, correct.
I think I remember seeing that. Okay. So why don't you maybe restate your question again,
Sure.
and then we'll come back to the comment in the chat shortly.
Yeah, so I think this kind of aligns with, I think it was Anna who made a comment previously, maybe about which one is the plan, which is the provider, and it's not on both. Kind of aligning with that. But normally, if there was a case management complaint against the CCO, you would report it under service type 22, but there's a new service type 37 that has case management, which also, so this, in other words, it would fall into multiple service type categories because it would be both the CCO plan and the CCO's case management. But I think that it's trying to align with the grievance types, and that there is one in particular against case management specifically on the previous tab. So I guess trying to understand the intent, because we're double reporting, but it's going to look, your data is going to be thrown off a little bit because it is the CCO still. It's just a subpart of the CCO, if that makes sense.
Got it. Yeah. And can you maybe, or I don't know, Carrie, is there anything you want to respond to that immediately?
I think that's something we'll definitely want to take back and think about. And I know, I think yesterday brought up potentially the need to define a hierarchy of coding. You know, that might be a way to tackle some of that. So just thank you for raising that. And yeah, we'll need to take that back and think through how best to approach there.
Okay.
Yeah.
And then I would just maybe ask, what else is being reported in that? And we can also do a look on our own, but if anything kind of comes immediately to mind about what you're reporting in that service type 22, that also might be helpful. And because I'm wondering if that service type could be eliminated and or collapsed with something else. I'm not sure, but maybe just knowing kind of what's currently being reported there. And as I said, we'll do our own kind of look back as well, but anything immediate that comes to mind?
Yeah, so I think everything that would be reported under the subtype of 22 for the CCO plan, you would be able to identify from the grievance tab when you look at what was previous called provider and clinic, but would now be against who it's against. But any complaints about, a customer care representative, customer service, like Anna put, flex decisions, case management is one of them. Their benefits weren't covered and they thought they wanted to be covered or should be covered. Scenarios like that, we would all put under 22, but you would be able to identify who it was against from that grievance tab further. And or through the grievance tab of this coding category where, it would be about the interaction with that person or billing with the CCO, for example, as one of them.
Okay.
I don't know if that made sense, but I just don't want to get too granular on the service types because that's a lot of mapping for our systems to have to do, right? And so if we can gather it in other means, then that makes more sense through our analysis.
Yeah. Okay. Yeah. Yeah. And we added, the approach we took was to add those service types that we felt were kind of areas that we maybe need to do some better monitoring around. Obviously, there's a whole lot that could, be added, but we tried as much as possible to kind of narrow it down to, what's immediately necessary, and also informed, that was also informed by some of that MACPAR reporting that I mentioned to CMS, where they are looking at very specific service types. And also just what we've learned over time, right? In terms of like, what are the areas where we we need to maybe have some improved monitoring around. Go ahead, Anna.
I was wondering if there are plans to kind of provide some additional guidance on how you want these service types mapped. There was some discussion at I think the first work group, and I sent an email with some examples of how we have mapped some of these service types for different, based on claims or prior authorization information. But I was wondering if you might consider having some additional guidance so we're able to do more of an apples to apples kind of comparison.
Across CCOs, yeah.
Yes, and
Okay.
to ensure that we're mapping things the same way that you're understanding them, that you're looking for.
Okay. That is helpful, and that may not be something we can do immediately, but I think definitely something that we can take back and think through to determine the timing of that. But yeah, I agree that being able to compare, consistently in, using consistent kind of fields across CCOs is going to be very important. So yeah, we'll definitely take that back. I'm not sure it'll happen with the release of these reporting revisions, but we can definitely take that back and start to think about how we do that. And maybe I would welcome, because one of our gaps, right, will be that we don't have insight into your systems, right? And so obviously we know what we know from what we see in CMR, but there's a lot more, right? And so I think I would welcome maybe if any folks want to be involved in some of that work and kind of helping to provide input and to also be willing to show us your systems in more depth. That could be immensely helpful as we go kind of embark on that exercise. Okay. Let's see, we had 2 items in the chat. And one from Melody: could the problem of being unable to determine if something is pending be resolved by including notification dates for withdrawals and dismissals too? Then any blanks would absolutely be pending. It's a great point, and we will take that and think through that. Okay, and then the other item is from you, Hannah, around complaints. We put complaints about flex fund decisions in the CCO service type. Okay, that's helpful. Thank you. All right, let's go over to, okay, so we were talking about the service type. So let me actually stay on this tab. We were talking about the service type additions. I know we kind of generally talked about the additions during our first work group meeting, kind of walked you through what we're thinking of adding. Just to recap, there are quite a few new service types that we've added. And also one of the goals is to have kind of an explanation of what our interpretation is of that service type and provide some additional examples to help kind of guide you. And I think hopefully that will be maybe an initial stab at some of that mapping, but I can surely appreciate that there's more to do beyond that. Are there any, I'm going to just scroll down here slowly. Are there any additional comments or feedback based on the new additions or the changes that we've made to this specific tab for service types. We talked a little bit about massage therapy, that was added. And then we also added the outreach and engagement, HRSN, service type. But any additional feedback on these changes?
For the orthodontics,
Mhm.
because you've added procedure codes, could you not glean that information from the procedure code? Because they're just 8,000 codes.
The service type?
Yeah, yes, correct.
Yeah. So yes, ideally, and this is actually one of the biggest quality gaps, data quality gaps in the reporting. Not many CCOs are actually submitting diagnosis and procedure codes. If you remember, we already have those in the PA log, integrated in the PA log, but we're not getting that information consistently completed and reported to us. And as we just talked about, we are adding them right to the NOABD log as well. So assuming that we get that information, and again, this will be kind of an effort to provide TA and really work with you all individually to ensure that we are receiving that information. Yes, you're correct. It's possible that we could utilize that information for our analysis. And I think until we get there, this is, what will kind of serve as the replacement. Any follow-up to that? I think it was Jennifer. So eventually this may potentially at some point in time go away, but for now we're still going to rely heavily on this service type categorization and the codes until we get there. Christina, do you want to go ahead?
Yes, just a thought. So this kind of ties in with the service type and then the log itself when it comes to the dental cases and the subcontractors and the delegates and whatever. So would it be sufficient to add a service type under 9 and have 9.1 for dental for delegates to be able to utilize it to show that this particular grievance or whatnot would fall under our delegated entity?
Yeah. That we will take that back and think through it. I don't have any, I think we'll need to think through that, but I think that's a good proposal. Okay. Okay, anyone else? Let me check the chat again here. Okay. Okay, Anna, thank you so much for resending that information. Can you and then there's a comment from Lindsay about describing the difference between outpatient and surgery. And I think we can maybe take that back and think through it. I don't know if, Leslie, you have any immediate thoughts from your clinical perspective?
I do. Outpatient services are typically considered such as maybe physical therapy or different from surgery, which is an actual procedure done in a standalone hospital or an actual hospital surgical ward.
Yeah, so we have, I think, to kind of talk through that a little bit, we have like PTOT, ST as service types already, right? We have imaging. So all those kind of fall under outpatient. So I guess just as a health plan ourselves, we were interpreting outpatient as outpatient surgery. And that's what we categorize under that one. That might not be the same for all health plans. So I guess outpatient would be, I mean, really anything that is not inpatient, right? Which would fall under lots of these. So I guess just getting
actually,
more
ER
clarity.
is considered outpatient. So yeah, you're definitely right. It's a larger category. I think it does require a bit more conversation.
Mhm.
So would it be helpful to have surgery defined as inpatient or outpatient, or with the differences?
Yeah, and I think so just kind of talking through what we do, which could be different, right? But what we do is anything that is inpatient, we put under hospital, or we have, whether that's an admit or an inpatient surgery is what we have been doing. And then anything that is an outpatient surgery, we put under 16, unless it falls under one of the other outpatient categories as a, hierarchy. But now it looks like we further defined hospital to just be an admit. So then that I guess if you are only looking for general admissions,
Right.
then that kind of changes that algorithm of mapping.
Yeah.
Kind of throws a wrench in it to further define that hospital if you don't mean inpatient. All encompassing inpatient services, right?
Yeah, for sure.
Yeah. We'll definitely take that back and think about it a little bit more. That was very helpful. Thank you for raising that, Lindsay. And then it just, I guess, as we kind of shift in terms of like, depending on wherever we land in terms of the level of granularity, I think we may want to have some conversations, and this is, I think, part of that mapping exercise, maybe to understand how things, what was being reported previously under which categories, which service types, and probably the same goes for grievance codes, and then what is, kind of current state versus future state, and that way, because we will need to know all of that so that we can, as we're looking to do trending over time, be able to kind of crosswalk where things were being reported previously versus where they will be reported moving forward under which service types, if that made any sense. It made sense in my head. But that was very helpful. Thank you so much. And then I do see a comment in the chat here from EOCCO, uses 16 for outpatient also. Okay. Alrighty. Any other, I'm going to just scroll down here a little bit more so that you can all see some of the other additions. Feel free to chime in if there are any comments about anything else that was added.
Hey, Veronica, this is Jill at YCCO. Yeah. My team asked if it would be all right if they did a review of the grievance types, the service types, and then we could do an email back to your team to give our feedback. Is that okay?
Yes,
they
please.
have a different perspective. They actually, they're in the work every day. And so I think it's a, good thing to ask them. And then our UM department actually wanted to look at the different types. So
yeah, please, we welcome that from anyone. That's really what will be very helpful for refinements to the reporting requirements. So definitely welcome that. Anna, do you want to go ahead?
Yeah, I didn't quite hear will there be some guidance about how to handle the services that fall into multiple categories. We talked a little bit about the outpatient and outpatient surgery.
Yeah.
There's pharmacy, and there's also family planning, which can include, some pharmacy services, or outpatient and family planning, because an outpatient and just about every other specialty on the list that are mostly delivered as outpatient services. I guess what are you expecting to see for those?
Yeah, great point. And I think this gets back to some of the previous conversations we were having around the hierarchies. But yeah, we will take that back and think through it. I don't have we definitely will respond to it. I don't know how,
Okay.
And or what that will look like. So I think we'll just maybe make sure that we're very clear about that in the reporting instructions. Yeah. Okay, is there anything you want to add?
I think it's also probably touching on, what we talked about earlier with reporting multiple codes and using, a row per. So, I think that will also be part of that conversation when there are multiple service types. Yeah. So lots for us to think through.
Okay. All really great feedback. Thank you. Yeah, go ahead, Anna.
Have you considered using the taxonomy codes and the provider information to get to service type, similar to the way we're using the taxonomy codes for the network adequacy monitoring?
That's very interesting. For we had not really thought about that for grievance. We're getting at some of that a bit with the addition of NPI. I believe that's on the NOEBD tab. Forgive me if that's not the right tab.
It's on the grievance tab. Yeah, because it looked like you were trying to crosswalk to our DSN.
Yeah. We'll take that back. That's a really interesting suggestion. Definitely wanting to use the taxonomy to identify the specific provider type. And I think for many of these services, I think that could potentially lend itself really well to identifying. There may be others where that's a lot stickier. So I think that's something we'll need to be very thoughtful about. But yeah, thank you for bringing that up.
Very helpful, thank you. Any other comments, thoughts about this tab? As you see, we have a note here at the bottom about whether we should add OB-GYN, and I think we were leaning towards yes, but we maybe wanted to get some input from all of you. Go for it, Pamela.
Yeah. So the only thing I would say about this, I think it's a good add, but it would need hierarchy and definition, just like anything, because OB, if they're having a baby, they're in the hospital, are they inpatient, are they OB? Gynecological and family planning can overlap. There's probably multiple other things that can overlap. So again, just keeping that hierarchy and or guidance of when to choose which in mind.
Would that work if it was OB/GYN inpatient or outpatient, like two separate categories?
I think there's still an overlap with family planning, right? And potentially pharmacy as well, and family planning.
Yeah, and even outpatient surgery. So hysterectomy could be outpatient, it could be inpatient, it could be gynecological. So depending on who's, as we mentioned yesterday, the more categories we add, the more complex it gets for our teams to answer in a consistent manner. And it's not just consistent between my team, but it's consistent between Care Oregon and all the other CCOs out there.
I think also
Very true.
from claims, it's really hard to map when we're really granular when it comes to claims as well, for our systems to build.
Now that I'm thinking, like having so many more service types being added for inpatient and outpatient, why don't we just add an extra column here and say inpatient and outpatient? So if it is an inpatient for the same service type, we can have that as yes, or like inpatient, and then for the outpatient, we can just have outpatient over there. Would that be easier?
At least for our system, that would mean we have to build twice as many service types. We don't have a hierarchy that we can select in our system.
Agreed. That's a pretty heavy lift.
Okay.
We have to basically reprogram all of our systems.
Okay.
That's the same for us as well. Even sometimes adding to the list gets dicey.
Yeah, and I worry again, like you were saying, Veronica, about like how we now trend over time if we're redoing all of our algorithms. I know for UHA, like we already have 60 or so auth types. That's how we do PAs, and then I have a mapping from that auth type to a service type, which then matches with the grievance and appeals as well, service type. So basically we would have to add all new auth types to then map to these service types to map to all of the planning. So it's a lot of work for the CCOs, especially if we have a short window in order to report in the way that you're wanting to moving forward.
Okay.
I don't think that was very intelligent of how I explained that, but just know that it's a lot. It's a lot of work of reprogramming everything.
I think we got the gist. Thank you.
Yeah, and that was something our teams brought up as well, is the concerns about losing that historical context in the system. If we're altering current service types to mean something else, we lose that ability to trend over time.
Okay. It feels like there's maybe, and if you're all open to it, some kind of ongoing work that we could do together in this space around the mapping pieces and just making sure that, we also have an understanding of what's being reported, and you do as well, right? What's being reported in your current state versus future state, and how we can go about doing some of that mapping. And trending really is where what I'm talking about. I'm not sure if that made a ton of sense, but it feels like there's maybe some continued kind of collaboration here. Okay. Let's maybe jump over to the grievance tab in the code tables. So here we have largely added for kind of consistency purposes, added some of that categorical description to give more details about what we would be looking for, right, in these different grievance codes. So that's just really more clarification. And let me, sorry, need to zoom out a little bit to see this. And then also those grievance examples as well. So that will be something we'll be populating. And again, that's for kind of clarification, ensuring we're all on the same page about what should be reported. And we did make some additions to the grievance codes, largely around NEMT. So as you can see here, we've added these two entries in row 14 and 15, and I'll make that a little larger again for folks. 14 and 15 around issues with NEMT provision, one being related to transportation driver error, the other being about call center, kind of scheduling incorrectly the ride. Excuse me. So those have been added there, and we are removing that top row that you see there at grayed out. So that was previously kind of an all-encompassing category. And so what we want to do is get more granularity about what is the grievance actually about, right, in the context of NEMT. And so we've removed that grayed out row in row 13. And then we've added 14 and 15, and we've done the, made it category L.1 and L.2 so that we can, to this conversation about trending over time, be able to kind of attach it to the current state reporting for category grievance type L, I should say. And then we added, I believe there's a few more down here. Just a modification here in column 27, where we remove that interpreter service. And if I remember correctly, it's because we added a specific interpreter services piece down here. Here they are. Row 33 and 34 speak about the, that specifically interpreter services not being available, whether it's at the plan and or provider level. And then added row 35 to better understand grievances around care coordination, case management, and made some modifications to rows 36 and 37 related to those consumer rights. We're kind of splitting out, we're adding this transport vehicle has a physical barrier or not ADA compliant, because that's been kind of an issue that we've seen come up with kind of just the lack of enough vehicles that are accessible. Generally speaking, not specific to any one CCO, but generally speaking, this is kind of a constant issue and concern that's raised. So we want to be able to kind of track that. And then jumping down to the next pieces here on consumer rights. We've, as you can see in row 41 and 42, have differentiated between plan versus provider, fraud and financial abuse. And then, oh, right now. So we have, and then jumping down to row 43 and 44, we have added some additional information here, again, adding that plan piece, right? So really trying to understand the plan versus provider differentiation. So we're seeking kind of similar information to what we were previously asking for, but now are just differentiating between plan versus provider. And then jumping down here to rows 51 and 52, again, consumer rights. I'm actually gonna phone a friend here. Carrie, these are completely new additions?
I believe so.
Okay. So it looks like, and let me scroll over to see if I can, no, okay. Looks like these are completely new additions. Row 51 and 52. That's grievance type M and N. And I apologize
Yes.
that
Those are new.
okay, that I blanked on that. Let's jump down a little bit further. I think there are a few more down here, a few more changes. Row 57, as you can see, we have added in there the NEMT vehicle being unsafe. And then the last one, yay, is kind of unable to determine because there was missing information that could not be obtained from the member. So with that, let's maybe pause and see if there's any feedback or questions about any of these, and I'm happy to scroll up wherever folks want me to go.
And just there's some comments in the chat again.
Yeah. Yes.
Lindsay and Anna, it looks like kind of making similar point around plan versus provider. And so I think we definitely need to take that back and be very thoughtful about, are we capturing that information on the service type tab versus the grievance tab itself. And based on what we've been hearing in this conversation, it sounds like changes to the service type tab perhaps, and please correct me if I'm miscategorizing this. We want to make sure we're understanding the feedback correctly, but changes to the service type tab just from a system kind of change, system overhaul perspective might be perhaps more onerous than the change to the grievance tab itself.
Any confirmation of that?
Can you restate that?
Yeah, of course. So in our quest to understand, is this is the grievance, is the issue with the CCO, the plan, or is this a provider, a complaint against a provider? Capturing that, do we do that on the service type tab? Or do we accomplish that through the information available on the grievance tab? And based on what we've been hearing around just how challenging it is to update systems to reflect new service types, new categories, would it be preferable to do that work on the grievance tab? So identify, this is related to a provider, this is related to the CCO, this is related to NEMT, versus trying to accomplish that through the service type categories themselves.
Well, oh, go ahead, Anna.
Go ahead. I was gonna say that we're adding in the grievance log, we're adding the complaint against, which is a code for provider, CCO, NEMT, or other subcontractor. We're also including an NPI and tax ID and a subcontractor or delegated entity name. So that gives you a lot of information about whether it's the plan or a provider, or if it's an NEMT provider, in particular, what kind of provider and who they are. So if we could minimize also adding specific grievance type and service type that duplicate those pieces of information, it would be helpful to us. It would be nice to add it in one place and be able to rely on it, because we may be faced with conflicting information then if our staff need to choose those different categories 2 or 3 different times in the same grievance or other, interaction with the member, we may end up with some challenges in trying to make all of that match and make it consistent across all of the different categories where they can choose.
That's a good point. Yeah.
Yep.
Yeah. Good point. We will definitely take that back and think through it. Lindsay, was there something else you wanted to add, or anyone else?
I think Anna explained it well in that if we're already capturing it in one area, I just don't want to duplicate or expand in another area that could cause additional manual error or, just, I think clarifying, adding the category description was super helpful on this tab. I think that was a great addition that can help our staff be more consistent when selecting the right categories. I'm just am fearful about expanding the categories again to get too granular when it's already being captured in other fields, like Anna described. So I think that kind of goes along with my other comment in there also, like adding transportation driver error specifically, or categories related to transportation alone that could fall into a different category, but still be, a provider error, but knowing that provider was a driver, for example. Or a late appointment could mean late pickup, but one's a provider and one's a driver, which is captured by the service type. So I just don't want to over expand the categories if they could fall into multiple categories, but be identified who it was against using the service type.
Okay. Very helpful. And you've both given us quite a bit to think about. We'll go back and kind of do some work to think through all of that. Okay. Anything else on the grievance code tab? We only have a few minutes left here. And I don't think I'm quickly reminding myself, we already covered the subcategory tab when we had our kind of some of the conversation around the HRSN specific additions. There's not a whole lot more to add there, but and we didn't make any changes to the action category tab because, as you know, that's defined by CFR. So I think that gets us through our conversation, with the exception of the grievance system report. I forgot about it. Nancy and or Erin, do you happen to have that handy that you can share your screen? And as I said, there's not a whole lot to share here. I mean, we're proposing to, thank you so much, Nancy, eliminate much of this report because we should be able to do some of these calculations ourselves once we improve the quality of the data, as I mentioned throughout the conversation. But that's what we will be doing on our end, is really calculating some of these pieces that you were previously reporting to us, and eventually getting to the point where we are providing you that information and you are letting us know if you're seeing something different in terms of your rate calculations. And just across the board, right? I mean, thinking about all of the entire appeal and grievance log, the hope is that eventually we will get to the point where we are producing dashboards that will go out to all of you to kind of, keep you updated in terms of what we are seeing on a quarterly basis, and that will initiate conversations on our end or any follow-up action that might be needed to really dig into some of the problem areas that we're seeing. So yeah, if you can scroll down through here, and this is the one, sorry, can you scroll right back up to page 2 there, Nancy? I think that's the one that made its way into the tab. Yeah, so that's the one that made its way into the log that I showed that we needed for MACPA reporting. And as we talked about, definitely is something that we could probably collect ourselves. I think, keep scrolling down, Nancy, please. So the only things that are left here are the narrative, and I think that that's, that's also up kind of up in the air, whether and I'd love to hear feedback from all of you, how much of this is kept and how much of it is, I think one of the challenges we have with narrative is that we often will get kind of similar information reported, and so it's not, maybe it's an issue of really being more specific, and making sure that we're very clear about what we need to gather and what information we are expecting you to send us. But there's, I think, some room for improvement also in terms of like what narrative is needed on a quarterly basis, like what extent of information are we constantly collecting on a quarterly basis versus, how much can we glean from the data that is being reported to us directly and that we will start to kind of look at more closely. So I think any initial feedback and or thoughts about it would be helpful. I think I saw something maybe in the chat from Christina about how EOCCO uses the tables to verify all the data matches the log. Okay, so for your purposes, you would prefer to have an option to utilize those tables if necessary. Okay, that's good to know. Anybody, anything you want to add there, Christina?
No, it just helps our staff from different departments verify, and then I utilize both of them to combine into one solid report to ensure that there's no misrepresentation of what's being reported. So we kind of really rely on that table.
Okay, and all of the tables or just which one?
So for the quarter that we're reporting for, the previous quarters we use to show the data to our board members. So it's kind of all encompassed in one.
Okay, so all of the tables that we've slated for deletion you actually utilize them. Is anyone else in that boat as well? Okay. Yeah, and I think there's nothing to say that we couldn't have an optional section, and you could fill it out if you wanted to, but maybe it won't be a requirement for everyone, just in case there are others who don't rely on those tables heavily. Okay. And then in terms of the narrative, and I think we any thoughts about, and I see Lindsay, you just dropped something in there about maybe it makes more sense for the narrative portion to be an annual report versus a quarterly report. I think that's what you're saying. Feel free to chime in. But I think that's definitely an option for us to consider. Because once we get, and we've been getting this information, right? So once we get some baseline information in some of these areas, it's not often that your process is going to change drastically, right, from one quarter to the next, that will require you to report something different. So maybe there's some alternative frequency that we can consider.
Could it be utilized mainly for if there were any changes that, like different departments for EOCCO updated their systems And so maybe any new changes for that quarter could be utilized. And then if there isn't, then just go for an annual. So everything's not being repetitive.
Yeah, I think so. It's almost like a change reporting. Yeah. Okay, that's helpful. And let's see, I think I saw a few more things in the chat. Let's see. And if the tables are not in the report, we will likely continue to use something similar internal for quarterly reporting. Okay. And then we usually include some trend charts in the narrative sections to help illustrate trends over time. Thank you, Anna. And then a comment from Jill. I think an annual report versus quarterly would be a good idea. Thank you for sharing that. And you know, there's nothing, I mean, you all definitely should have your own internal, you know, processes for monitoring this information on a regular basis. I definitely, you know, encourage obviously looking at this information on a very frequent basis, right? And ongoing, and not having to wait until these quarterly reports are completed to really be able to do that ongoing monitoring. That definitely is something that should be incorporated into your regular, you know, monitoring process. Okay, well, this has been very helpful. Any final comments on this? And like I mentioned earlier, I think there's maybe some continued work to do together. Nancy, was there anything, I think we kind of quickly looked at everything, but was there anything else we needed to call out here in the grievance system report before I go to what I was about to, what I stopped mid-sentence?
I don't think so. I was just double checking seeing about comments, but I'm not seeing anything, so I think you're good.
Okay. Okay. So I think there's some continued work to do for a few different things that came up in our conversation. And so if you're all open to that, we definitely would encourage maybe some and appreciate some continued collaboration in this space. And maybe it's with this group of folks that we continue that work. But I think there's definitely some places that we want to continue to get your feedback around. I think I saw, whose hand did I just see? Anna? Was it Anna? Maybe not.
It was me. I was just thinking, I wanted to put in a plug for making these kind of reports something that's also useful for us for internal reporting and monitoring as well, so that we aren't doing two sets of reports, one that we need in order to do adequate internal monitoring, and then an additional one that is slightly different but mostly the same information that is for OHA for monitoring. So just whenever possible, having those align, it is very helpful for our administrative capacity.
I think that's a great thought, and I guess I maybe would open the door for continued conversation and feedback in that space, because the granularity of what you will have to monitor is obviously going to be different, right? From potentially different from what we might be looking at. So I don't quite know how we get there, but I think there maybe is some opportunity for alignment. I'm not sure if we'll get all the way there, right, in terms of having one report serve both needs, but definitely open to having that conversation and to you know, exploring that further as we kind of dig deeper into improving appeal and grievance system reporting.
Yeah, I was thinking of it in particular with the narrative report and removing some of the elements, because we've been using that also to present to our quality committee for their quarterly review. we include a lot of other like trending charts and information in that narrative report. And so removing some of that from that report, we would still need to do that, but then we would be producing a separate report for OHA than what we're currently using. Yeah.
Okay, and I mean, there's nothing to say that it couldn't stay the way that it currently is, right? And maybe we look at different frequency of reporting for that specific part. But that's helpful feedback. Thank you. And we're over time here, so I want to be respectful of your time. Thank you all so much for your contributions and for all of the feedback that you've provided. Please submit any additional feedback that you have, let's say within a week, by end of business next week on August 7th. And then that way we can continue to move this forward and make our final revisions to release the changes. And if you have any feedback about the implementation timeline, I think we really would love to hear that. Our hope was that these changes wouldn't, we're looking at making some of the HRSN changes are more immediate, and obviously there's still a whole pending conversation around that and where that's going to land. But some of the other changes, I think we definitely, we're looking at maybe updates within, I think we talked about allowing 2 quarters, was it, implementation?
I believe so.
I believe it was, yeah. I believe we talked about allowing for a bit of time, 2 quarters for implementation of those changes to your systems. And so I'd really love to get some feedback on that and see if that feels adequate, recognizing that, like, we anything kind of beyond that, like we'll obviously have to kind of weigh that, right, with some of our own internal priorities. Thank you all so much. Have a great day, and I really appreciate all of your engagement and feedback in this work group. Thank you.
Thank you.
Thank you.
Thank you.